Welcome to the Voices of Otolaryngology podcast series, where we spotlight diverse perspective and insights within the field of otolaryngology. I'm your host, Rahul Shah. In this episode, I had the honor to talk with past President Albert Merati regarding the importance of investing in the next generation of the specialty and specialty unity, as well as the crucial conversations he has led at the annual meeting to respect all pathways into the practice of otolaryngology at a neck surgery. Let's dive right in to learn more about his journey and passion for normalizing the path in otolaryngology and keeping people together. All right, Al, well, thank you. We're going to have some fun, light moments. Could you tell Academy members, perhaps, how about your clinical duties? Then we'll talk about your Academy roles.
I'm an otolaryngologist. My practice is just in laryngology. I've been doing that for 27 years. I work in Seattle, my hometown, at the University of Washington.
So as a laryngologist, does it upset you if I zoom in and if I have bad optics and if my elbows are moving, it's going to get you very upset?
I think the members
if I'm not braced.
I think the members will see the joy and awesomeness of what we're doing.
Okay, terrific. Al, why are you one of my buddies? What have been your Academy roles? You are probably one of the most popular people at the staff offices. Everybody says, say hi to Dr. Merati, say hi to Al. How do they all know you? What would have been your Academy roles? If somebody's new, how does everyone know you?
Gosh, thanks for asking. My Academy journey started as a enthusiastic member. I got my way onto the neurolaryngology subcommittee back then.
Okay.
Became the chair.
Wow.
Transformed into the airway and swallowing committee, got involved, ended up representing on the one of the old committees, the SAC, and I got my exposure to the board. And during each one of these events, I realized that all the people up front, all the people who were talking were cool, and I wanted to learn from them. Some were more entertaining than others. But that there was Academy staff and teammates making it all work and teaching me the ropes. And so I made sure to communicate. I made sure to try my best to get to know their names and really thank them, because I saw the care and concern of what they did, and connect them as I brought other people along, say, like, remember, this is how it works. And I was fortunate enough, I ended up running for president, becoming Academy president, which was, of course, such a joy.
And what year was that?
2018 to 19.
What do you think, if I ask you probably your three greatest achievements as president? I could list a lot, but how about Academy members?
For me, I think the things in retrospect will mark my time with the launching and energizing of this medical student initiative.
Yep.
And the medical student membership.
Right on.
It's a dream come true. Jim and I talked about it, Dr. Danny, and just having folks identify, having folks feel like they're home for their careers.
Yes.
Everything from sweating applications to feeling included. That was a more successful, I think, than either Jim and I.
So let me interrupt you. So do you know, Dr. Merati, at this last annual meeting, or let me just say, we have 1,100 medical student members. That started from you.
Yeah.
I think before your term, there were less than 100.
Yeah, it's...
So everyone who was a medical student that became a resident otolaryngologist, thank you, Al.
Right on.
That's awesome.
And we say thank you, because I say this with a twinkle in my eye, but I always say, hey, we ought to be paying attention, right? These are the people who are going to shape the Academy, pay the dues, go to the meetings, and shape the initiatives and policies. So we ought to be paying attention to our earliest core members.
That's exactly right. Exactly right. So you're really proud of medical students. Maybe another one or two accomplishments that you look back now. It's been 6, 7 years, perhaps 7, 8 years.
Yeah. My time was really also focused on really getting Reg-ent off the ground, and all the gains being realized now, I think, had their foundation in having a messenger go to the Schenectady meeting and the laryngology meeting and the Arizona meeting, just saying why there was value at that time, which was very, very much ahead.
Avant-garde, yes.
Yeah, very much happy to say, there was value in having otolaryngology driven, otolaryngology designed, otolaryngology owned database. And
so there's some cynics out there, which are fine. It's okay to be cynical. I'm looking at the members. We need to engage you and show you value. So Al, we have 11 million patients, 50 million data points. Can you believe that?
It's amazing.
And when you started it, I mean, it was
nothing. We had nothing.
Yeah. Gene Brereton, Jim Delaney, you all started with this idea.
Yes, and I think just the idea that people, that there was the wisdom to see that a requirement, an external requirement, could be flipped on an opportunity to own and control our own patient experiences and our own professional lives through everybody individually partnering with the Academy. That was great foresight, great investment, and I think it will continue to pay greater and greater dividends over the years.
So the podcast series is called Voices of Otolaryngology, and I always like to start with the clever title, and I think you said it there, and I want you to go a little bit deeper on that. One of the great things about Reg-ent is we took a regulatory requirement, flipped it into member value.
Absolutely.
That's the vision you saw.
Absolutely. It wasn't, I mean, it's funny, I was struck that the nimble practices were really on it early, and I think there were some structural problems. 1,500
practices now, Al.
It's amazing. It's amazing.
Can you believe that?
Yeah, and I wish my colleagues, I'm a lifer academic, but I really put a lot of passion into connecting and listening to our members in private practice and the Reg study group. I'm an otolaryngologist, right? That's who I am.
Correct.
Even though I'm a lifer academic, I tried to listen, understand, and learn, and I was frustrated by some of the adoption within academic otolaryngology.
Understood.
I think
that it wasn't moving at the pace that you thought it should.
Correct.
Understood.
And I learned from my private practice folks, just why they cared, how they responded, and it was very energizing.
Yeah. Well, I hear from our academicians, how do we make it more accessible? How do we use it for database studies? NISQIP is a perfect example. So that's my commitment. How do we unlock the value of Reg-ent?
Totally.
So medical students, you almost 15x that. We went from less than 100 to over 1,100. Reg-ent, you probably 1,000 times X'd it. I don't really know. I mean, that's order of magnitudes out. Anything else as president that makes you incredibly proud? I would stop right there, but am I not giving you a chance to brag about something looking backwards?
One's a little
And I'll have one more to tell you that I'm going to surprise you with. Okay.
I like this. I was really focused on specialty unity. I wanted to say I am an otolaryngologist.
Yes, specialty unity.
Yeah, and I think just having people, come to the specialty units, the Unity Summit, and just say, okay, what?
Al, when did that start?
Well, it used to be, had a different name.
Yeah.
And then when Gavin Setson was president in 2017, that was, I think, the first named specialty unity.
So then you carried that on.
I carried it on, and we just tried to keep relevant. I'm like, why should anybody care? And the concern was we wanted to keep open dialogue.
Yes.
We wanted to recognize that, here, this is not the cake we baked you.
Yes.
Here's the cake we can bake together. Like, that was part of the issue, is like people felt at times, rightly or wrongly, that things were getting done.
Yeah, sorry, I was still thinking about baking. Okay. This isn't the cake we baked you, but we bake it together. Yes.
Let's bake it together.
Yes,
what kind of cake you want to make? Because we got stuff to do.
So you are part of the Academy logo. We are one.
100%. I believe that. I think we need to sit together. We obviously love our field. Yeah. Let's just,
I mean, I'm a card-carrying member of ASPO and TRIO.
Right.
And the Academy. Yourself?
Myself, ALA, ABA, TRIO.
And the Academy.
And the Academy.
Right.
And I tell you, when I would talk to a member who was trying to decide about staying a member, I said, okay, I'm never wagging my finger at anybody. These are smart, concerned, caring community leaders who are making a reasonable decision. Yes. Maybe they just don't have the information.
Yeah, fair.
I say, I believe in you. Tell me what's going on. This is why I think it matters. Right. And then bringing people in, and with professionals, Elite Spine-Heart, others in the ELT, the Academy staff, we had a really, really good rate of hanging on to members and growing the membership, even beyond the medical students.
What are you doing these days with the Academy?
I am very lucky that this will be, I think, my last year helping with the awards committee. And there's one thing I am really holding on to left over is I'm still involved in the medical students.
They're your favorite, Al.
Yeah, it's a joy, and just kind of be a resource for them.
That's terrific.
We're sponsoring some webinars that we're doing, some courses, and then we're just trying to get people going. And
may I ask, do you mind if med students who listen to this, if they reach out to you?
100%.
Would you mind giving your email? I'm serious.
Yeah. No, my email is Merati at uw.edu. Twitter is still Merati if you want to reach out through there. I didn't do any of the hip stuff. So
No, I
obviously-
think X is pretty hip, and we call that X now. Way to
Okay,
go.
I know,
Yeah.
I know.
But you really don't mind if a med student reaches out to you. You'll direct them to where they need to be.
I direct them. I can help sometimes. Sometimes I can't.
Yeah.
depending
I mean,
on
you
the
can't take
issues.
1,100 students on your clerkship.
No, but I'm happy to be heard. Happy to hear what they need to say, and especially as it resonates with our general push for member engagement within the academy.
It's great. What can the academy do for our members? What do you think is one of our most pressing issues?
I believe one of our most pressing issues is understanding the workforce. The incredible work that the workforce survey. You got to read it if you haven't seen
Yeah,
it.
AJ Tompkins.
It's phenomenal.
The
AJ,
workforce. What intrigued you about that workforce survey?
It was the deepest dive in the modern era about things that motivated, things that the pathways people were choosing, the finances, where people were living and working, and it showed some real issues in terms of where people are working, where people are not working.
So, for example, how do you take that and turn that into a priority for the academy?
I believe one of the issues be make sure folks feel like the pathway they want for themselves. If they're in a medical school in Laramie, Wyoming, which is they come to the University of Washington for medical school, for example, wherever they want to do their practice, that we as leadership in otolaryngology and membership in otolaryngology find a way to value their journey and support their journey. I think my colleagues in academic otolaryngology have inadvertently driven a whole bunch of students to wear a mask, to conceal their real wishes about what they want to do by really making a system where they feel like they have to say they're going into academic medicine. I think this is not our best foot forward for otolaryngology. I want to change that. I want to normalize all career paths. I want to provide opportunities and training for folks that have different career paths. It's not all academics looking for future academics. It is noble, it is wonderful. I love what I do, but it's not for everybody. I want to do a better job, and the academy membership is the place to drive this conversation.
Yeah.
There is no single body that has oversight over the workforce. It's not the RRC, it's not the board, but the academy absolutely can host and drive and lead this conversation.
So, Al, what programming did you do at the annual meeting regarding workforce?
Yeah, I was excited by the wonderful work that the workforce team had done, Dr. Tompkins, Dr. Bowe, lots of folks. And I thought, gosh, we need to work on this, because looking in the future, when I meet with otolaryngologists, they say, I can't hire a partner, I can't get call coverage. Otolaryngologists who are caring, wonderful community people, but they're starting to concentrate more and more in bigger cities. And then I look at the workforce and I thought, why is this happening? And this is where we drove this conversation. We called it the Crucial Conversations. We started in Nashville and it had part 2 in Miami.
Okay.
Asking ourselves, is there something about training, the fact that academic programs, I myself as an academic lifer, that are we inadvertently driving folks to wear a mask when they walk into the door of otolaryngology? Because we want, programs want folks that may want to do academics.
So let me be provocative there. You're an academic lifer.
Mm-hmm.
So you're being introspective and you're asking yourselves, are we forcing people into academics, otolaryngology residents, and that's limiting our workforce de facto?
Yes.
And so what happened? What did you talk about in part 2?
Yeah, so I think, and it's not intentional, I think people are acting rationally. The students are wonderful. The academics are caring people. They're excited. They're not plotting. It's just they're excited. And I think what happens is it affects special unity. I think it affects special unity because if from the beginning we treat people like there's different groups, and I think that corrodes special unity. It's not us and them. That can't be. Otolaryngology cannot thrive with an us and them attitude. We saw it in the old ERAS applications when there was a call out for academic potential. I'm like, this is not the path forward. So when we know that these students, and you see academics, they'll wink at each other about it. They know the students, a third of them probably have to say, I'm interested in academics.
Sure.
And we know it's not true. Why do we do that? We can do better than that.
So you did a part 1 in Nashville, part 2 in Miami.
Yeah, so
Or is there going to be a part 3 in Indianapolis?
Yes. So
And what are you going to do now?
I think we're going to bring
Give us solutions?
Yes. So the first solution we talked about, in addition to raising awareness, was to explore the idea of having more private practice experience in residency. We know from the workforce that people want it. Yeah. If you're telling me you train leaders and you're not training people in the breadth of otolaryngology, including private practice, I don't think you're really doing a great job.
So Al, I know we've moved to an area where people can't see me. We had 18 months of private practice rotations in my residency, and it was transformational. I learned so much, starting with respect, teamwork, and the real value of private practice otolaryngology, serving communities. Did you have private practice rotation?
I did.
Where did you train, by the way?
I trained at UC San Diego. It was a phenomenal program. I was a T32 NIH resident. This was.
But you had private practice.
I worked at Kaiser, so as in organized medicine, but the individuals were. It was a purely clinical job. It's phenomenal.
So you had rotations within Kaiser.
Absolutely.
That probably has impacted what you learned, for real. I mean, it's such an ideal model, Kaiser, right? So now when you're in academics, you could take some best practices from them.
I can, and then I teach our trainees, listen, when you're talking about a colleague down the street,
yes,
that's right. And most people practice this, but I fall into this sometime. I may get this us and them vibe.
No,
we are not great when we need to be great by being better than other people and defining our greatness by being better. That does not work. That is not thriving. Our thrive is to feel that we are doing the best we can in our chosen path to normalize paths and keep people together. And this is my push. I want my young doctors to fall in love with otolaryngology, have a program that embraces them and trains them, and have them go serve their communities, which is their passion. I do not want folks to wear a mask or feel like they can't be authentic when they come into the door of otolaryngology.
That was a beautiful mic drop. So Al, as we wrap up, 2 more questions. What are you planning in Indianapolis for part 3 of Crucial Conversations? This is a teaser, so I'm not going to hold you to it.
I will spend the next several months in the run-up to these meetings gathering support, whether it's regional support, governmental support, to look for ways to expand programs, to look for accountability for the federal tax dollar that goes to fund the majority of residency spots.
Sure.
Because I am not sure, no matter how great the individual training is, I'm not sure overall, one level up, that the taxpayer is getting exactly what they wanted.
So you're looking at system levels, and you might bring those discussions to Indianapolis.
I intend to.
Right. That's fascinating because, at our core, we respect and value each other, but we have to demonstrate that at a system level.
Absolutely.
Yeah, really well said. I mean, I said it myself, so I'll say it's very well said. Al, Voices of Otolaryngology, what comes to top of mind for you? What do you want to get out to our 15,000 members across the globe? It's yours, sir.
We all find the spark that takes us into otolaryngology. The things that drive us nuts about our job are generally not unique to otolaryngology. They're really about the current state of practice of medicine. All the more reason that A, we stick together, B, we respect each other, and that we find that the most passionate, joyful part of our day is practicing the actual gift of the medicine and surgery and the human contact of otolaryngology. So hang on to it. It's not easy. It's tough for our early career folks, but hang on to it, hang on to each other, respect all pathways.
Al, any good podcast, I'm going to come back on camera when we do this, any good podcast ends in a good way. So we can bump it out, we can shake it out. How do you like to end your podcast?
I like to say, hug it.
All right, Al. Thank you so much. Al Merati.
Thank you, Rahul.